We're at the IS meeting. We're here with Annette Sohn, who's done amazing work with AMFAR in the field of adolescent medicine. And the work you're doing, I think we want to cover it from way back to, but very capsulated, from way back to where we are and where we want to go.
Sure. So I think at this conference, the message that is coming through very strongly is about the importance of adolescence in prevention, adolescence in clinical care and treatment, and as well as differentiated care, that needs to not just be about adults, but also looking at young people living with HIV. And in particular, I wanted to remember with you in a way that the last time we talked was about the Depivirine ring trial, where they found that the results were not as robust, actually didn't work, for young women under the age of 22, and this sense of I guess concern, but also frustration. How come these young women did not use the ring, which in older age groups is found to be a very effective intervention. And so today we had results here at the IS conference in Paris about a study done in American young women here in the United States, where they had a targeted intervention using the Depivirine ring and very high rates of acceptability, over 90%, as well as of regular usage of the ring in the 80% and over range. And so I think what that shows us is that when you focus research specifically towards young people living with HIV or young people in general who are at risk of HIV, you're going to get a much better outcome than if you lump them together with other adults. And so very excited to see that the trial looking at the Depivirine ring in young women will be starting soon in sub-Saharan Africa in 4 countries. And so I think that message was heard loud and clear by the clinical research community that we have to target studies for young people at risk of HIV and young people living with HIV, and cannot just assume that they're, again, smaller adults.
Right, it's true. So the drama that unfolded over the years has been pretty amazing for the lack of ability to do include people, young adolescents in research. And I think we always considered it phase 4, which is after the drug is approved, we'll say, oh, by the way, let's see if this will work in adolescents or this will work in pediatrics. And now it seems as though we're making that leap to just include as much as we can in the initial work and the initial trials, or at least being aware that that drug is going to be available for that population. It'll be able to be formulated for that population.
Absolutely. We've been hearing very loud and clear from young people living with HIV and, again, at risk of HIV, that they want to be part of these research studies, not at the end, not after the results have been published, but at the time that the studies are being developed, at the time that the studies are being implemented, part of community advisory boards. And that means that the rest of the research community needs to build capacity among young people so that they can effectively be part of the overall research process from the beginning to the end.
Can you speak to what AMFAR is doing currently and so forth in the Treat Asia and so forth?
Sure. So AMFAR's Treat Asia program remains one of the only regional level HIV research programs in the Asia Pacific. Our pediatric program is in 6 countries in South and Southeast Asia, but our adult research program is in 13 countries. And so we're continuing to focus on looking at HIV treatment outcomes. And we're contributing to analyses such as the one presented yesterday here in Paris on CD4 at ART start, and showing that we're continuing to see people coming in too late with advanced HIV. And so our goal within the region, and I think globally, is to really bring people in for testing so that those who need to be on treatment can access treatment.
Right. And can you say, now I think that we've covered kind of the past, because that is a big drama, but where are we going? Where are we headed? What are the new things that we can look forward to? What are the new opportunities for adolescents?
I think for adolescents, it's very much about what does it mean to be on lifelong therapy. If you're diagnosed as a child or diagnosed as a teenager, you're looking at a whole lifetime of treatment. How do we make that treatment easier? And I think it's simplification of regimens, but it's also long-acting antiretrovirals. So we've heard a lot about that today in the prevention arena, but we're starting to get questions from our young people saying, when are the injectables coming? Not just for the people who don't have HIV, but for the people with HIV. When can I get that for my treatment? And so I think that's what we'd really like to see in the future for young people, an easier way to be treated.
I think the important thing is to send the right messages, make sure that we give hope, but also space it out so that we say, it is our expectation that this is what's going to happen, but research is research. You know, we don't know the outcomes. But we also know that there's a lot of work being done, so it might likely be that you're going to have these better treatments. Not only that, but the ability to take a treatment that'll last a whole month, which would be a fabulous thing for young people, especially because they don't like to have their lives interrupted every day with a drug or a treatment or whatever it is that they have to take for them.
I think this comes back to stigma and discrimination. One of my patients went to an overnight camp. She takes 7 pills a day because she doesn't like to swallow big pills.
And they got to know why she's taking them.
Exactly. So how can she hide 7 pills a day?
Yeah, sure. Well, I appreciate all the work you're doing, and I want you to know that we're with you in your work.
Thank you. Much appreciated, Fred.
Thank you.